hope to welcome Dorina. She is amazing. She's a psychologist from Ohio. She owns her own consulting company called Works of Faith Wellness and Consultation, and she supports perinatal mental health, as well as she's been working on her certifying as a bereavement and doula, birth and bereavement doula with Sisters in Loss. And she's got a very open, honest, and vulnerable memoir called Pregnant with Promise, which is a spiritual journey of pregnancy, bed rest, and childbirth, which details her journey with pregnancy loss and complications. So she is just amazing. We are so fortunate to have her, and I welcome you very much. And she is welcoming any of your questions or feedback. And I probably should introduce myself as well. I'm Melinda Peterson. I'm the board chair of Return to Zero Hope. And I'm also a healthcare provider and lost mom as well. So I will be managing the chat while Dorina is giving this amazing talk. And so if you guys have questions along the way, she welcomes that. And I will write them down and kind of just pause her as we need to, and we'll get those answered. So I really appreciate you being here, and I'm just so excited to hear what Dorina has to share with us today. Thank you so much for being here.
All right, thank you, everyone, and thank you, Melinda, for that introduction. Also, just want to say thank you to Kylie and also to RGZT Hope, just for allowing me to be here in this platform. We are going to go ahead and get started. Okay. All right. Is everyone able to see that? Hopefully, Naz, yes, I can't see you all. So hopefully everything is up and running. But we are going to be talking today about mental health in Black and African American communities, and specifically ways that we can optimize resilience. I do not have any disclosures. And as a disclaimer, this is a webinar for informational purposes and is not considered, of course, to be any type of professional advice. I want to start by saying that, as Belinda mentioned, I am a lost mom. I've actually had an early miscarriage as well as a stillbirth, which was my son, Joshua Alfred. And so I have a strong connection to this topic. I also, during my pregnancies, subsequent pregnancies after Joshua, experienced perinatal during pregnancy, anxiety and depression that really went largely untreated. And not sure why. I think as a psychologist, my providers knew I was a psychologist, maybe made assumptions about my ability to manage what I was experiencing. And so I am also someone who has anxiety. So I have this history and this connection to this topic that is really dear and near to me. So I want to be transparent about that. Also, and you all bear with me, but I'm doing this webinar in memory of my cousin's son, Keyshawn Rhodes. He died on February 13th, so just a couple of weeks ago, and his death was a suicide. And I want to share that because I think there are still so many assumptions we make about mental health in the Black and African American communities. And we do experience a lot of things, and we want to end the stigma. We want to honor those. So if you can, for just a moment, let's take a moment of silence for and in memory of those who have died to suicide and their family members. Thank you for that. So, as we begin, we are going to talk about the context in which we should at least consider mental health in African Americans, talk about some statistics, looking at challenges to mental health care, talk some about common mental health conditions. I will try to be brief since most of the individuals on this webinar are providers themselves. Just bear with me through that part if you're a provider. Some of that may be redundant. And then we'll look at strategies for developing resilience and also some thoughts about choosing a provider, and also what providers, what we can do in our work with individuals of African descent. So just as an introduction, you may hear me use the term Black and African American interchangeably. What we want to understand is that when we talk about Black and African American, people will identify that in different ways. We want to understand that the group that we are speaking about is not an homogenous group. There is lots of diversity, even in terms of how we identify culturally. It can include individuals who identify as African, African American, Black, Afro-Caribbean, and even multiracial. Also important for us to consider other intersecting aspects of identity. And they're all listed there, but I think there can be a propensity to really look at and say, you know, okay, this is who we're serving. And with anybody that we're meeting with, we know that they bring a richness of their history, their culture, their identity to the room. And so we want to be conscientious and conscious about understanding what those identities are and what they mean to that person. So really important for us to know that may be a point that we're already cognizant of. So just to reiterate that, it is imperative that we not make sweeping generalizations. In fact, when I thought about talking about this topic, I was like, boy, how will I do this in 60 minutes or 45 minutes? I mean, we will try to do that. It's such a broad topic and there are so many considerations. So in terms of thinking about I'm going to move that. Contextualizing mental health, we really have to understand the context where we live, what our history is in this country. And our history is one that includes the enslavement of African descendants, racism, and even white supremacy. Now, does that mean that every African American that we see, or as individuals ourselves, that our experiences are all going to be the same, even though we live in the same context, the same society or community? Absolutely not. It is going to be very different for that individual. But if we don't understand and acknowledge the context of what it is to be an African American in this country, then we're really missing part of our understanding and how we can access help, the things that we may struggle with as African Americans and even as providers. Then how do we use that in our work with individuals? We also really need to be cognizant of the current racial and social climate. So it's connected to our history, but when we look at all of the things that are happening in our country, that have happened in this country recently, there are so many things that can affect our mental health. These are some just things that we know about experiences of African Americans in the US, that we are disproportionately affected by police violence. We have higher rates of imprisonment for men and women of African descent in comparison to other racial groups. There are also greater disparities that we know in terms of access to economic resources, safe, affordable housing, and employment. And of course, with my area of specialty, I would be remiss if I did not highlight some of the higher rates of maternal and infant mortality in Black birthers and babies. So if we just even sit with that for just a second, we really begin to understand that one individual's experience can be affected by each of these things. And while I, as an individual, can say all of those things that I've just mentioned are not my personal experience, all of those things have affected me by people that I know, people in my community, people in my family, every single one of those. And so that by nature is even going to affect my experience and things that may impact my mental health. Um, you would have to have completely not been on TV and not gone outside to notice the impact of even seeing different demonstrations that have occurred. Um, and you can name various, Black Lives Matter, Black Trans Lives Matter. So many different things have been present for us in this time and has affected us, not to mention or forget, of course, the impact of the COVID-19 pandemic. We know that issues of access and access to relief resources, testing, and even at this point, the vaccine, all of those things are still a challenge for under-resourced and in some ways, Black, Indigenous, and people of color. So we also know just across the board, not specific to Blacks and African Americans, but there is an increase of emotional distress associated with the COVID-19 pandemic and with the social unrest that we've experienced. And this does include the continued devaluing of the lives of non-binary individuals and including non-binary individuals of color. So as we talk about some of the statistics here, it is important for us, again, to think back to the context, to think back to the history, to think about our current environment. And so when we look at what's happening with some of the mental health statistics of African Americans in this country, we want to look at them through a different lens. So we do know that Blacks living below the poverty level are twice as likely as other Blacks to experience mental health complications. So more depression, more anxiety, and other types of mental health complications. And we'll talk specifically about that. We also know that African Americans are more likely to be diagnosed with psychotic disorders and symptoms rather than mood disorders. And we think about, like, what is that about? And there can be this sense of, well, maybe there's something genetic, or maybe there's something in the genes. And that's not really the picture there. There are ways in which African Americans are assessed, some of the experiences of African Americans, and the way that their symptoms are assessed for that may make them more likely to be categorized as such. So we do need to understand that. And also, African Americans are less often offered medication and therapy. So if we are not getting a clear picture, if we're not getting a good assessment, it's going to be difficult to treat. But sometimes there is not an offering of treatment. And then we do know that sometimes there's an offering of treatment and it may not be accepted. So we want to be thinking, more complexly about, well, what is going on there? What's that about? Um, um, Blacks with severe mental illness are more likely to be incarcerated. What's that about? And we can think about that even in the context of higher incarceration rates, period. And what does that mean? More use of emergency rooms and care from primary care doctors than from mental health providers. Black men less likely to use mental health resources than women. And really stunning here, most of these statistics, by the way, will come from Mental Health of America, Center for Disease Control and Prevention, and the NIH. But 90% of African Americans, first of all, 12 years and older, we don't always think about that with substance abuse, but did not receive treatment. So treatment is being underutilized or not offered. And we do know that sometimes that can be connected with what we see in terms of incarceration rates. Also, we do know that there is an increase in African Americans deaths by suicide. And an interesting article in the journal, the JAMA Pediatrics in 2018 shows an increase in suicide in Black children ages 5 to 12. Like, that is staggering when you think about that. So these, again, are just some of the ways, what we know about mental health. But again, we have to think about them in a particular context. So, what are some of the common barriers to seeking and receiving treatment? Some of those differ in terms of who will reach out and seek assistance, and then how we receive or access that. So, insurance coverage, this statistic, the one I have, 11.4%, is from other research deemed to be lower, on the low end of how many African Americans are uninsured. Stigma and shame is still such a significant part of our experience trying to access treatment, or our willingness to seek it. Things like, I don't want people in my business. Okay, well, that certainly can prevent us from accessing that. But maybe we need to be thoughtful about, but why don't you want people in your business? What's there, and what needs to be addressed in that statement? And then even, Black people don't do therapy. We do. We do therapy. But maybe I don't know people who do therapy. Maybe that's not been my experience. So it may be my experience that we don't do that, because I don't know anybody who does. So how do we, again, consider all of these things? Lack of knowledge. There are people who have no idea that what their experience, what their symptoms are anxiety. It's like, oh, when you explain it, and to say, have you ever had anxiety symptoms before? It's like, well, I don't know what that means. So no, I don't have that. I've not had that experience. But if I really don't know what does anxiety mean, then if asked about it, I may not endorse it or say that's my experience. Or I've just lived my life this way, and I didn't understand that what I was experiencing was depression, because I get up and go to work every day. I'm not one of those people who can't get out of bed. So then I can't be depressed. But we know that depression can occur on a continuum, and that many people function um, and experience depressive symptoms. We clearly know that there's a history of lack of trust, specifically with medicine. I've heard people say, the doctors don't listen to you anyway. So why should I talk about what's bothering me when I don't know if I can trust them, if they're going to listen, or what they're going to do with that information? And that's really important, because it became clear to me, even just this week in talking with someone, that a lot of assumptions can be made about, well, what happens when you go to the doctor? And it seems like, well, you go to the doctor and you talk about what you need, or you talk about your health. But some people don't understand what that really means. And so if you don't understand that that means going to a physical medicine doctor, that I'm going to talk with you about your health, talk with you about how your body feels, provide some options for treatment. You can talk with me about what your experience is. I'm going to share with you some information. If they really don't understand that, then there may be a sense of, I'm not sure what to do with that. So, and I don't know what that's about, so I may not engage. And then I'm sure many of us providers as well, as just individuals interested in this topic, will say that, well, I talk to my friends. I don't need to go to therapy because I have friends for that. or, my partner and I are really close. So I have that. I don't need therapy. And then, prayer is the only therapy that I need. And I love some of the recent t-shirts that say prayer and therapy, because we can do both. But sometimes we don't understand that we can do both, because the one we know, prayer, the other, I don't actually maybe not even know what therapy really is. I hear people talk about it, but I don't know what it is. And we'll talk about that as well. Other things, lack of access to African American providers. Here over and over again, I can't find a Black therapist. I can't find an LGBTQIA plus therapist. And the reality is sometimes there is a challenge. Um, but we have to then try to find ways to connect with people. Maybe I don't know, but maybe somebody I trust knows someone. And I'll talk a little bit more about that. But then this last one is really interesting. I want to point that out because I had someone in this panel discussion not too long ago say that it was an African American, and they did not want to work with an African American therapist because they didn't want to be judged. So even that can be a dynamic with providers, and also with individuals who don't understand, again, what is therapy? What is going to happen in there? And, they may not understand confidentiality and things like that. So I think it's really just a lot of work to do in terms of understanding what people may need to be able to engage and use resources. We talk about culturally competent providers. And what I will say about this, just briefly right now, is that we have to do our own work. Whatever your race is, however you identify racially, as a provider, you have to do your own work. You need to understand your unconscious biases. You need to understand racism and how it impacts you, how it impacts the people that you serve. And we need to be practicing from a space of cultural humility, where we attempt to understand, acknowledge, accept, and use a person's culture as part of a resource for them. And then lastly, lack of appropriate assessment and treatment. It is so interesting and working with women of color, and it'll be interesting where I'll clearly see that there's depression. But if you weren't looking closely, you'd think they were okay. If you weren't listening really carefully, you think they were okay, because they are going to work. They are functioning. They are doing what they need to do. They're still taking care of the house. They're still doing things. And so it's like, oh, well, they seem okay. But just because somebody seems okay or they look okay, they may not be okay. So we have to do a better job of really assessing and understanding the needs and how different people may present. Others, he didn't mention anxiety during the appointment. Again, if we think about it, do clients understand what we mean when we say anxiety? And I know most of us, will break that down and really, explain that. But sometimes we are so kind of in that moment, and we may forget that, oh, I guess I didn't. I guess maybe they might not know what I'm talking about. And then, when I ask them if they've ever had a manic episode, when I'm assessing for that, again, most of us are assessing for very specific things. We'll talk about what that is. But if we just ask about a manic episode, I don't know, maybe not. So just some of those things, again, probably things we're already knowing and practicing, but maybe good reminders. So when we talk about mental health conditions, what are we really talking about? We talk about depression and anxiety, but what are we really talking about? When we talk about mental health diagnoses, it could also be term disorders, complications, conditions, but essentially we are talking about whole body conditions that may be impacting what seems like one particular part, which is your mind, your thoughts, your emotions, but it's connected to your whole body and your whole experience as a person. And we need to be aware of that. So if I am experiencing depression, anxiety, or if I have high blood pressure or diabetes, those things are going to be connected. So we want to be thinking about these conditions as whole body conditions and part of the whole person. They are often caused by imbalances of neurotransmitters in the brain, fluctuations in hormones, stress and distress. And sometimes we don't know that. It's like, well, neurotransmitters, okay. We can talk about what that is and the ones dopamine, serotonin, norepinephrine, the ones that impact us, because sometimes for individuals that we're working with as providers, or even myself as an individual, if I don't understand what may cause it, then I may be less likely to engage in certain types of treatment. So, if I don't understand that my blood sugars are not leveled, then I may not understand how insulin or the use of medications help balance that out. The same way, if I don't understand that there is this neuropsychological basis to my depression, to my bipolar disorder, then I may not understand how the medication comes into play. And so providing that education and understanding that can be really critical. We know that conditions that we see can affect family members. And so, we may see things in ourselves and learn that, oh, that's anxiety. I learned that I have anxiety. Like, well, there are people in my family. I don't know if they've ever been diagnosed, but I can see some of those same things in other people. And we don't want to diagnose other people, but certainly it can help us to understand that there can be also kind of a biological basis with that. And then that these conditions are treatable. And that's good news. And they can be treatable with various things: therapy, self care, medication. And we're going to, of course, talk more about those things. What mental health conditions are not are character flaws. Having depression does not make you weak, it does not. It is a condition, neurochemical, that can be treated. It does not mean that you don't have enough faith if you are someone who practices faith. Um, it doesn't mean that you don't have enough faith to kind of move past that. Um, it's not punishment, and it's also not just what we would consider normal or typical sadness, grief, or loss. Those things can be connected, but it's not the same. It's nothing to be ashamed of. We really need to do what we can to address shame and stigma around mental health conditions so that we can empower people, empower ourselves to be able to access the resources that we desire. And then um, for some people, it's like, well, it'll probably just get better. Um, Sometimes perhaps, but generally there is something that needs to change: your thoughts, your behavior, the way that you do things, the way that you interact with people. Something has to be different for there to be a different result, or for you to experience a change in the symptoms or the things that are causing you distress. Okay. All right, I'm going to move along pretty quickly. Not going to share a lot of statistics here, but I do want to share that about a recent study shows that about 10% of African Americans experience what we call clinical depression. As I go through these specific mental health conditions, I won't again give a lot of detail, but I do think it's important for us to know and understand a little bit more about what these things are. Um, do not diagnose yourself. These are meant, again, for just informational purposes, but I would encourage you, if this is something that you're experiencing, that you do check with your provider. That could be your primary care doctor, if that's someone you're already connected with. If you can connect with a therapist, obviously that would be helpful as well. And we'll talk about ways to connect and find those people. But it can be, this persistent sadness or crying, changes in sleep and appetite, low energy. And some people will say, well, I'm not depressed because I don't feel sad, but they may just feel like they don't care about anything. and things that they normally would care about, like that apathy, what I like to call like just blah. Like I'm not sad, I'm not crying, but I don't care about things. That can also be a characteristic. And then sometimes, but not always, people will experience more of this irritability, frustration, like just short tempered. And that can sometimes be it. Now, if you are experiencing any of these things that you see listed here, don't diagnose yourself, go and speak with someone to get more information about your specific symptoms. Thoughts of suicide or suicide attempts, difficulty concentrating, focusing, hopelessness, feeling like things aren't going to get better. Those are some of the things that can be indications for depression. One last thing that I will say, and that I have noticed in treatment with individuals is um, many people don't understand that depression can be cyclical or it can occur in episodes. They don't understand that even if I'm taking medication, the symptoms may come back stronger, or it may come back and I thought I was okay. And there's a lot of frustration that can occur because, well, I thought we were past, like I thought I was past this, and that's why I'm in treatment. So why did it come back? And there can be frustration with that. So I do want to just point out that depressive episodes can be cyclical. They can come back. I mean, sometimes there's not a trigger again, especially if there's something, if the neurochemistry is an impact. Anxiety, again, a lot of people don't understand necessarily what it is, but it can look a lot of different ways. But that excessive worry, sometimes feeling like something bad's going to happen, or just having unrealistic feels, being nervous, feeling like you can't relax, those types of feelings. And it may not even be the physical symptoms, like with a panic attack where you feel the physical symptoms in your body, your heart racing, feeling short of breath. It may not be that. It may be more like a feeling of I'm just not settled, or I just worry a lot, or I worry about everything. Um, those may be an indication. Some people hold tension in their bodies, so they may notice their anxiety as that tension in their shoulders or jaws. Um, and then have difficulty sleeping. Many people will say, as I'm going to bed, I can't sleep very well. I can't get to sleep well because my thoughts are going. Sometimes that can be an indication of anxiety. But again, check with the provider as you're trying to tease some of that out. There are some subtypes here. Again, I won't necessarily go into detail, but I like to highlight obsessive compulsive disorder because sometimes people don't get that, or they think, they've seen a movie where someone's washing their hands and they keep washing their hands, but it can look like lots of other things that we aren't always aware of, including where we just kind of get stuck thinking on something like, oh my gosh, I can't believe, we haven't gotten to the dishes, and I just can't stop focusing on the dishes, and I'm trying to focus on my work, but oh my gosh, the dishes. It can be one of those things where we're ruminating, or even cleaning. And I know sometimes people will joke and, well, no, I'm okay. I just clean a lot. Like when I'm anxious, I just clean a lot. But sometimes those behaviors can be disruptive to our functioning. And that's where, of course, we want to start looking at them. And then, of course, specific phobias and post-traumatic stress disorder, which most people know of as PTSD, is often triggered by, or is triggered by, stressful or traumatic events, whether you observe them or you experience them. So I'm gonna now just generally just mention, initially I said I would just kind of cover the most common mental health conditions, but I think in an effort to reduce stigma, I want to acknowledge these other conditions that we do experience, including bipolar disorder, which has about a 4% prevalence in adults, period, not specific to African Americans. um, because these are conditions that are often misunderstood. I'll just share this brief story. I was talking with someone who believed that she may have had some anxiety. She knew that she was kind of keyed up and really was feeling just like she had a lot of energy, but she kind of characterized that as anxiety. So we did some assessment, and kind of looked at some depression as well. But after the testing, there was some information that suggested that she may be having bipolar symptoms, so more of that hypomanic, high energy, those types of symptoms. And initially, when we were talking about depression and anxiety before we'd done any testing, it was kind of like, oh, well, I really didn't think of myself as depressed, but okay. But then when we started to have the conversation about what was bipolar disorder, what those symptoms were, it was almost like I can wrap my mind around depression, I because that's common, or I know about that. But bipolar disorder, it was almost like, well, I can't be that. Like that did not fit. And it wasn't because she was saying I don't experience those symptoms. It was because I feel that's a very stigmatized condition, and I don't know if I can accept that. And so we did a lot of work talking about that. But I think it is important to talk about and acknowledge psychotic disorders, the most common being schizophrenia, um, that we do experience those conditions. African Americans do experience eating disorders. 1% or less for most of the conditions like anorexia or bulimia you may have heard of. But for binge eating, the rates are increased, and that binge eating is eating abnormally large amounts of food and kind of out of impulse, usually when you're upset or stressed. So really, again, important to just highlight, there is such a thing as adult ADHD, and African Americans do experience that. And of course, we have the range of substance abuse disorders. So I want to, again, just briefly mention those so that we can, again, reduce some stigma of those conditions in our community. Other things, just going to say again briefly, I feel like my time is narrowing here, about stress. Um, we talk about stress, and sometimes there is this propensity to undermine the impact of stress. So I may not have one of, a mental health condition, but sometimes other things can affect my mental health, including stress. So that's why I wanted to mention this. But stress is our body's physiological response to a situation or circumstance that we perceive as threatening. That can be emotionally threatening, that can be physically a threat. It's the way that our body's going to respond. So, if we were to all, walk out of our homes and we see a pride of lions there, unless you just like lions, you're gonna you're gonna have some reaction to that. Your body is gonna kind of kick in, and we're gonna talk just briefly about fight, flight, or freeze. But your body, that's the physiological way that your body is preparing you to address a situation that is threatening. We want that reaction to occur. What can happen is that brief acute response, or that initial response to a stressor is helpful. But for some people, when you experience chronic stress, then that means your body is kind of always in this state of physiological response to the stressor. So that means there is more impact on the way that your body functions, and not just emotionally. So I really just want to bring home that point. And there can be a number of things that affect us in terms of stressors, and I've listed some of those things here on the side. I won't go into those details, but I do think it is important to understand what stress is and how it can impact us, and of course the various things that contribute to our stress level. I mentioned earlier the fight, flight, freeze. Just want to point out that when we are, again, in that stress state, it's our body's way of preparing us to respond to whatever the threat is. So what we know is that our body is kind of preparing for action. So it prevents us from feeling sleepy. And think about this in the context of like someone coming into the emergency room. If someone's coming to the emergency room, it's like all hands on deck. The people who are there, the doctors, the nurses, they have to be ready to respond to whatever comes in the door. So fortunately, their body's in this space of preventing sleep, slowing or stopping digestion, slowing or stopping urine production, which is good because if there's an emergency, we want their full attention, right? If I'm in an emergency room, I want whoever's working for me, I want their full attention, and not that they're hungry or they need to go to the bathroom. So it's the body's natural way of doing that. But again, over time, if you notice that your body is always, or you're in this chronic state of stress, then you may have problems falling asleep. You may have more digestive issues. You may be releasing more cortisol and just finding it more difficulty to relax. So it's important to just kind of point that out. And then lastly, definitely important for us to understand the role of grief and loss in our mental health. Um, I remember going through my time of loss and just how impactful it was for me and how I felt emotionally. And whether it is an anticipated loss or there has already been an actual loss, that affects us and how we feel emotionally, and so we want to be cognizant of that. The one thing that I will point out with regards to grief and loss is that it's not going to look the same for everyone. We know that, and that it can be complicated by multiple losses. And sometimes our grief is not resolved. Not that resolution means kind of we've forgotten, we've moved past, but what it means is that it's impacting how I relate, how I function, and so it's become something that is another challenge or barrier for me. So, all of these things can affect our mental health, whether it is an actual mental health condition, or our stress level or our experience with loss. So now we're going to turn to what can we do? Where do we go from here? Now that we have this context for understanding, what might impact our mental health, what might be our experiences, we're going to shift our attention to developing and optimizing resilience. So when we talk about resilience, we're talking about our ability to adapt and recover from challenges, setbacks, adversity, and our, just ability to adapt in changing environments, some of which obviously is impacted depending on our mental health, or other things, stressors, other things happening in our lives. Um, Dr. Rita Walker recently wrote a book, I think just last year, about, I think it's the Unapologetic Guide to Black Mental Health. And she talks about psychological fortitude. And this is she termed this as the ability to think and manage your emotions, and pursue your life purpose. And what I like about what she added, kind of is extending this idea of resilience, is that we can't rely on the same level of effort that has protected us during other periods in our life to remain intact. We have to reapply our protections. So that means what may have worked for me in the past, or what's always worked, I may have to make some adjustments depending on what my now life circumstance is. So even if this one thing that I've always done has always worked for me, as I continue on in life and experience different challenges, I may have to make some adjustments. And it may not be good enough for me to, oh, I did therapy when I was, in my 20s, and that's great. But maybe what I'm dealing with now in my 40s or 50s, I may have to now go back to that, or introduce something new. So I wanted to include that. And then I love this picture, and I think it's really telling that we need people. We need support. We need connection. We need people. And it can be challenging when we don't have those resources, or we feel like we don't have that. But we can develop that and put that in place. But there is this sense of, we talk about it in our, African American culture, it takes a village to raise a child. And it takes a village sometimes to just keep ourselves in the place that we need to be to function the way that we want to function. We may require a team of people. So just want to highlight that. So I'm not going to go through every single one because I know we just don't have time for that. And I would like,
Karina?
um, yes,
Hi,
sorry.
it's Melinda. No, I just wanted to quickly tell you, you can go over 11 actually if you need to, because this is really important information and I love what you're sharing. So please take the
Oh,
time you need.
oh, okay.
Yeah.
Okay, thank you. I know I'm feeling a little pressed here, so I'll slow down a tiny bit. Thank you.
Wonderful. Thank you.
And so thinking about again, how do I put in place my team and what is that going to look like? And one of the ways that we can get through the challenging times, whether that's with our stress or our grief or our anxiety or depression, is connecting and finding community. As I mentioned, we really, it's difficult to do most things alone. And whatever and however you define community, making those connections can be really essential. And then connecting with organizations, including RTZ Hope and other, community organizations that are involved in anti-racist advocacy. Those things are really, really important because we want to be places where we feel like, okay, they get it. They get it. That helps us to make connections and to make treatment and just access to resources more accessible. And then I didn't talk a lot about microaggressions, but um, it is something that African Americans will experience and other BIPOC individuals. So again, this is not specifically to African Americans, but there are these like unintended ways that people will engage that seem harmless, but can be damaging for the person of color. um, and sometimes an example of that could be someone giving a compliment. It's like, gosh, you're just so intelligent and articulate, and it seems like a compliment, but it may pick at and be even in some ways upsetting or insulting, to almost make it seem that like my intelligence is unique somehow, and that I am somehow unique. And again, people who may be the aggressors in a situation with the microaggression may not understand that at all. That something that they've said has been offensive or taken as something that was racially charged for someone. And so sometimes, and I will say for myself, sometimes you just feel exhausted and you're tired. And it feels like, oh, one more thing that I have to address. But it is important for us, if we are experiencing a microaggression or overt racism, that we be able to confront those things. And confront, it sometimes doesn't have to be very, kind of in your face, but it can be in a way that lets someone know that something they've done has been offensive. Um, Disconnecting from individuals that don't feel healthy for you. I could probably talk forever about setting boundaries and ways to develop healthy relationships with people. Of course, I won't today. But sometimes we do have to take a step back. Um, we may not feel like we can sever a tie in an unhealthy relationship, but we may have to set a boundary. We may have to say that I know this relationship isn't healthy for me. I know it contributes to me feeling bad about myself. So I have to set a limit. So that means I'm not going to go to that person's house every Saturday and hang out, even if I've always done that, because I have insight now and I realize and I understand that doing that hurts me. It's stressful to me. And it can be really difficult, especially depending on who you're setting the limits with, if it's family, if it's a partner, um, someone that you set that boundary because they may not understand why you're doing it, or they just may not plain like it. But we sometimes have to make hard decisions about how we interact with people and who we interact with, if it is creating stress and distress for us. Um, if you ascribe to spiritual beliefs, utilizing those, sometimes we have them and it's part of our lives, but we may not use them to help us to get through challenging times the way that we can. And so I certainly, anyone who, ascribes to a specific religious or spiritual belief, to really try to tap into that as part of your toolkit. For, for getting through some of these challenging times. And then I also will say, I can't say enough, there's lots and lots of research about practicing optimism and the benefits of being positive, even health benefits, living life longer benefits. But it's hard. And I consider myself to be an optimist, and I live in the house with someone who considers himself to be a realist. But I challenge him sometimes to, you can be an optimist and a realist. You can develop that, even if it's not a natural bent for you, to, focus on the positive. It's possible to develop that. And we do know that there are mental health as well as physical health benefits for doing that. Um, we do have to stop in some ways for some people being afraid to acknowledge that we're struggling. It's a tough one, especially, again, so many things that we could talk about. But, when you think about for Black women, this perception of us needing to be strong. Well, boy, if I am buying into that, in some ways that may serve me well, but if it's to my detriment, and it leads me to not ask for support, and I continue to take on the burden and continue to take on more, um, that may not be helping me. And so I have to not be afraid. I have to step out of this mold or this way of thinking that I can do it by myself. I can take it all on for my family. Usually we can't. We may be doing it, but we may not be doing it well. And it may not be good for us. You can be a strong Black woman and you can ask for help. So that's my little soapbox. I'll step off of that. Other things, really, really important to be aware of how you feel and where you're at, I would say emotionally. For many people, I sometimes ask, so how do you feel? Well, I think that was kind of silly. Well, but how do you feel? What is your emotional state? If we can't connect to our emotional state and where, what we're feeling in a moment, it's going to be really hard to kind of talk about my symptoms and how severe they are if I don't have a good sense of what's going on with me. Am I stressed? Am I sad? Am I upset? Am I lonely? If I don't have an awareness of those things, and how they may be impacting my general mental health and well-being, it's going to be really challenging. Prioritize your needs. Again, I'm going to kind of skip around here. Your needs are as important as the people around you. And I say that I work with mothers a lot, and people, we take care of people. If you're in the sandwich generation, you may be taking care of parents, you may be taking care of children, but your needs matter. And I'm pausing for effect there, but your needs matter. And we need to understand that if we don't take into account our needs in relationships, and just individually as we are determining what we're going to do, then essentially we may be feeling like and given the impression that what other people need is more important. And I would argue that I do not believe that the needs of others don't matter. They do, but mine matter too. So we have kind of both and. Um, I would say this just in terms of, news events can be very triggering. This is more of kind of a concrete strategy. But sometimes we need to know, we need to disconnect, and even not just disconnecting from certain relationships or certain situations, but even news and media. It's okay to take a break sometimes. We need to do that. I talked earlier about kind of whole body, and I'm very much a whole body provider. I want to, I'm interested in the whole person. So, when I'm talking with someone about their mental health, I'm also talking with them about their eating habits. We people have emotional eating tendencies. The way that we're managing our stress may be through eating. If we are doing that, that may be having an impact on our general health and well-being. Um, Exercise is a wonderful stress relief. And, maybe your thing is not running, but maybe your thing is doing Zumba, or maybe your thing is yoga. But whatever your thing is, you'll likely get some benefit in terms of your mental health through exercise and through activity. Even if you just walk outside, and I don't want to, I apologize, it's not even just walk outside, but if you walk outside, that's good for your overall well-being. And we need to consider those things. And then lastly, I will say, um, there can be these what we kind of call comorbidities, where we have people with depression and substance use, tobacco use, alcohol use, and that use may become abusive or too regular and maybe impacting our health. So we want to be cognizant of, do I have a glass of wine every night, or every a couple of glasses of wine, or even 3 glasses of wine every night? And if I'm doing that, what is that about? Is it I'm just having it with dinner? Or am I using that to kind of take the edge off of something else? And if I'm having consequences to that, then I want to be able to consider and look at that so that I can optimize my ability to get through challenging things, to address what's really ahead of me. These are just some other strategies: journaling, obviously relaxation, deep breathing, body care, massages, all things we can do. Self-care is a really important part of being able to get yourself through difficult times. If I don't take care of myself and my body, it's going to be hard for me to fully reach my potential, and do the things that are important for me to do. So these are just some other strategies. I do want to move forward to talk about therapy. It was so funny when I started this presentation. My slide right after the next slide, instead of this slide, was going to be how to find a therapist. And I thought, I've missed something, because I know that there are people who don't know what therapy is. And who really, we say, oh, you should try therapy. And some people are like, well, no, or I don't need to. But in part, sometimes we don't understand what is it. So we're going to demystify it. What is it? Therapy is the process in which an individual is talking. So they're sharing information about themselves with a qualified, trained professional, and with the goal of finding relief, solutions, strategies to improve their well-being and functioning. Now, some people will say, but I got friends that I talk to. So that's why I don't need therapy. So the point here is that qualified trained provider, there are, trained professionals who have degrees. That information is going to be different than what you will get from a friend. And it's a different process. So even though you're talking to a provider the same way you might a therapist, the same way you might talk to a friend, the information that you're going to get back, the strategies, the insight, is going to be different. And for lots of reasons, but in part because your friends know you in one context, whereas someone that you don't know, a therapist, is going to know you in a different context. And I think it's important to note for therapy, some people don't know that therapists are bound by confident to ensure confidentiality. Um, we ethically cannot go and tell your business. So what you share with us is private. And people need to know that, because I've worked with people who they didn't know that. They didn't know that was part of therapy. that what they said was confidential. It could be different modalities, individual. So that's where it's just one-on-one, just you and that therapist. Sometimes you go with your partner. Sometimes you go with your partner and your children. Or you can be in a group where everyone in the group is working on a general topic, maybe depressive symptoms. But some people don't know there's different modalities of treatment. And then there are different techniques and approaches. So, focusing on your thoughts or the behaviors, things that you're doing, how you're problem solving, focusing on self-care, and even how you relate to people. Really important to highlight this. Again, some people don't understand this. The psychologist, the therapist, the social worker, the provider that you're working with, even psychiatrists, they're going to ask you about your life. And it may not be comfortable to share that, but it's part of the process. They are not kind of getting in your business in a way that's inappropriate. They are trying to understand you as a person, what your experiences are, so that that can inform the work that you're going to do together. So they're going to ask you about your family, your relationships, your history of substance use, your symptoms or how you're feeling, your work history. So all of those things are typical and standard. So if someone asks you a question in any of those realms, that's typical. And then you could experience through the process more emotional distress. So some people think you go to therapy and you're going to start feeling better and it'll all be better. And yes, you will see improvement in how you're feeling over time, but because you are uncovering and you're talking about things that may have been from the past, not always, but you're going to at least acknowledge those things or touch on them. It can be hard to talk about some of the things that you're dealing with. So it may be really tough to be in therapy for a while, but it gets better as you stick with it. But it is important to know, because some people will say, this is not working because I don't feel better. It's part of the process, but ask questions of your provider. If you're seeking therapy and you don't get it and you don't understand, ask your provider about it. Some people are in therapy short term, 8 to 12 weeks, that time frame, and some people are in therapy for years. It depends on what you need. Some people are there for a short time, they stop, they're good, they're using their strategy skills, and then they may go back, and that's okay. But it does involve you talking as the individual seeking therapy and discussing your challenges. That's typical of the process. As you choose a therapist or a provider, and when I say provider, I'm also including like psychiatrists, people who prescribe medications. It can actually go for any type of medical provider, but obviously specific to this context, mental health. Consider what you need. What do you prefer? Who would you like to talk to or sit with? Because you are going to be talking about a lot about you. So who will you feel comfortable with? And even if comfortable is too much, who do you think you might want to sit with? Finding someone who's trusted. Sometimes that can be a real challenge, and I tell people, if you have someone who who's been in therapy, asking questions about that, talking with people that you know and trust, and then connecting with, organizations like this that have trusted resources. It makes it a little easier to try to get connected. Finding providers who understand and practice cultural humility. So they're taking into account individuals' values, beliefs, cultural, linguistic needs as well. Remember, you can advocate for yourself, and you need to feel comfortable. And if you don't feel comfortable and you need to do something, you need to make some changes, you can do that. Other just practical considerations, as you consider therapy, you want to be thinking about, what kind of insurance is my insurance going to cover it? Do they have a sliding scale fee? Those are the types. How am I going to pay for this? What kind of issues does that provider work with? What kind of expertise do they have? For some people, it may be if there's a specific issue, like maternal mental health, you maybe want someone in that area, so you can ask about that. But most people are in the situations they have the appropriate training and certification. If you need medication, who would the person refer you to if it's a therapist? Many therapists are not prescribers, so they don't prescribe medication. So, but maybe they have people that they work with. You want to understand that. What's their experience working with African Americans? And really, really pay attention to the practice policies. And I'm going to come back to this just briefly when I give a couple of tidbits for providers, because um, sometimes people, when they're signing things, they're signing and they're moving on. I mean, how many of us sometimes look at all of the the details of what we're signing? Sometimes we sign and we keep it moving. But we want to be clear about those practices, because what I've noticed is I have seen recently, I work in healthcare as well, and there'll be these providers who they've kind of fired patients, or the patients can't schedule with them anymore. But part of the issue was the patients didn't understand that as their practice they can only cancel so many times, or there was some policy that was put in place that they didn't understand. And maybe they were given it but they didn't read it. So really, really important as a consumer that you do read the policies and understand that. um, Looking at other considerations, what is my role? What is a therapist's role? Do they have an approach? I had someone tell me the other day, like, she just kept asking me, how do I feel? And she was irritated by the fact that her provider, the therapist, was asking her how she feels. And so we talked about it. But maybe you want to understand is, the style of that provider. Like, she expected that that provider was going to tell her what to do. So we had to talk about expectations around that. So these are some other things. I won't read them all because I know you can see them. Lastly, for providers, I'm wrapping up here. Thank you for your patience. But as providers, we want to make sure that we are doing our own work, that we are exploring our unconscious bias, that we do understand racism, that we get the current climate and how that may be impacting those that we serve, and how may be impacting us as we do the work with the people that we are, that we're providing services to. And then we need to learn about and practice cultural humility. Again, you can take a whole workshop or class on just that topic. But we need to be about that practice if we're going to really support mental health of African Americans. And then examine your policies. I referenced earlier the policy, and individuals who are not being allowed to schedule appointments. But imagine if, there is some part of the policy that someone doesn't understand, or that really it may not be serving the demographics that you serve. So we may have to look at, what are our policies? What are our practices? Are there things that we're doing that are making it difficult for people to access our services? And if we're about providing the service and wanting people to have access, then we need to make sure that there aren't policies that are in place that inadvertently may be making it more difficult for people to access. Um, and then the last one I'm going to say here, because you can kind of see the other things, is really being mindful of how we think about non-compliance or non-adherence. There can be many, many reasons why our clients or patients aren't following up. And if we make assumptions about that, they're disengaged, they don't, I don't know, I don't even know why, but they're just not doing it. Well, let's understand why. Let's inquire. Let's be ready to ask questions. Let's even not assume that they know everything about what we're asking them to do. So let's check in. Do they understand? Do they get it? Is there something getting in the way that we haven't asked about or we don't know? And that we're not going to just assume, but they're just not doing it. So I've talked a whole lot. I'm going to stop talking now because I would like to talk with you. But those are some considerations. Just as a summary here, I forgot to mention this, I will make this information available to you. So I would like to, at this point, allow for questions. So, and I will say, just lastly, thank you for taking your Saturday morning or afternoon, whichever coast you're on, to be here.
Thank you so much, Dorina. There is so much important information here. And those of you who can't stay with us, we will make the recording available to everybody who's joined today, as well as we will be making it public on rtzhope.org very soon. I want to check in the chat and see if there are any questions. And if not, in the meantime, if people are thinking about their questions, I actually have a question for you, Dorina.
Sure.
I am really interested in what you've noticed that's helped kind of reduce the stigma about receiving therapy and about receiving care for mental health in the community. You mentioned like the t-shirts, therapy, and prayer. That's cool, but really cool actually. Have you noticed other things too that have seemed to work? And who are the messengers in the community? Like, have you noticed like, faith leaders or,
Mhm.
yeah, in particular, anything?
Yeah.
Yeah, I would love to hear more about that.
Yeah, I think what I would say and what my observations are is it's everybody, like we all are. And it's so interesting to, as a mental health provider, to say, like, I have anxiety. And it's like, well, if she has anxiety, how's she going to help me with anxiety? So it could be this sense of like, well, I don't know about that. And even as a provider to say that, like, to say that, yeah, I've had anxiety and I've dealt with, perinatal depression. That can be tough to say, but I think, the willingness to just acknowledge that it's something that happens. It's something, that is can be influenced neurochemically. So it affects everybody. Like nobody is exempt. But I think you mentioned faith leaders. Absolutely. A lot of the work I've done has been with my church, and and then having faith leaders to really to embrace and talk about you can still practice your faith and be a committed person to your faith, and you can be in therapy and you can meet your other needs. The fortunate thing is we just have this plethora of resources. And if we can tap into all of what we need, that's going to help us to be more resilient. So I would say, providers talking about it, if we've experienced it in certain contexts and situations, but educators, community organizations, having the opportunity to share, it really can. And I think even things like just not assuming that people get it. I literally had someone today just say, people have recommended therapy, but I don't even know what that is. And so there's this assumption that, oh yeah, you can go to therapy and they'll help you. And it's like, but what is that? So talking about it, like breaking it down, all the way down, that can definitely be a help.
That's wonderful. Just reading through the chat too. Thank you so much for that response. There are a lot of thank yous. People really appreciated your information and said they're going to rewatch it. And
Oh,
yeah, because I mean, there is so much rich information here. And let's see, Terry Major Kincaid said, thanks so much for inviting us to advocate for ourselves and to find someone else if we don't feel comfortable and respected. That is huge in therapy. I know personally, I've shopped around with different therapists, and that is completely okay. And Terry went on to say, I think sometimes as persons of color, we normalize not being respected and stay in hopes of getting what we need.
yes. Oh, wow. That's a powerful statement. And it really is. And you would think, I mean, even when you talk about like people knowing what they need, sometimes we have to pause and really get a grasp of like, what do I need? Somebody asks, because even if somebody asks if I don't have a good sense, it's like, I don't know. But even when we do have a need, trying to figure out how to meet that need can just be a challenge. So I'm glad. I appreciate that. And glad that that's been helpful. And there was a lot. It was a tall order. I said, boy, when you talk about mental health, I mean, there's just so much that you could cover. So I hope for providers, some of that information wasn't, talking about, specific mental health conditions wasn't too redundant. But I think it is important to just not make assumptions and to really break down the information.
Right, and for me as a nurse, it helps me, really explain what therapy is for, my patients, and so I think that that was super helpful, even though I know what it
Okay.
is, it's sometimes
Yeah.
a little difficult to explain, right? What they can
Hmm.
expect. Tiffany just said this is a very timely conversation. Thank you, Dr. Alfred, for sharing your story, experiences, and insight. As an AF/AM bereaved mom, MH provider, and one who suffered with depression and anxiety, this resonates so much with me. I do have
Hmm.
to go. I can't wait to rewatch. So much good stuff.
Okay.
Yeah.
All right. Well, great. Well, I'm happy to answer any questions. And I know I went over, so I apologize for that. But hopefully, if there are any questions, follow-ups, definitely just let me know.
hmm Yeah, I just have one more question. Since there's
Yeah.
nothing really coming up just from me. Um, just about, I know that it can kind of, when you're looking for a therapist, and you mentioned such wonderful suggestions and strategies for looking for a therapist. There's psychiatrists, there's psychologists, there's social workers, there's all these
Mhm.
different types out there. And just, if you, I know it's like a lot, but if you could break it down simply for people, just kind of what those different options are and what they can do for people.
Yeah, really good question. So you can be, you can have your PhD and be a psychologist and be a therapist. Generally, when we're talking about therapists, we're talking about, licensed um, um, marital family therapists. We're talking about social workers, licensed counselors. That's kind of, and psychologists, kind of the range of people who do the therapy. So the top portion of the therapy. And then you have certified nurse practitioners. You have psychiatrists, and even sometimes primary care doctors who are prescribing medications. And so that's, the prescribers generally are the individuals who are going to bring in medication or supplements. They're going to talk with you about another form of treatment, whereas those counselors, social workers, psychologists are going to do more of the talk therapy that I described there. So yeah, it is kind of hard to kind of tease out like who should I be looking for, or which providers is going to do what. And even some people will say, well, what's the difference between a social worker and a counselor? Like, what? How I choose one over the other? And I would say, I love people having websites because you can look at their websites, you can look at their profile, and you can get a really good sense of who they are as a person and what they're about. So anytime I refer someone to counseling, I try to get them connected so that they can see something about the person. They can see their picture, they can learn a little bit about them because it helps you to feel comfortable with like, okay, I can sit with that person. I might be able to talk with them or relate to them. But even one of the things I think with psychologists is that we do a lot of, we can do testing. And psychological testing specifically, but social workers do therapists, we do therapy, so you can really kind of choose from all of those. And I would say that's the biggest kind of differentiation for us. There's some others, but that's the biggest one. I think I did see another question in there in the chat box about elders, maybe. I didn't see it all.
Yes, yes. This just came up from Cynthia. This is an excellent question. How do we encourage our elders, our African American elders, to be supportive of therapy? Yes, there's no generational differences, right? So how do we address that? Big question.
That is a good question. And so it's gonna kind of depend. If it is, for instance, getting them to seek it for themselves, there may be some challenges there, and there may need to be, this idea of spending a lot of time providing education. Well, this is what they do, and this is what that's like, and this is how it could be beneficial to you. And showing them, if they're willing and open to look at like a website or something on a phone to say like, okay, so this is what this person does. That can be helpful. But even if it's, maybe it's an elder and they don't understand why you're doing it, and may not be supportive, and they may say, well, I didn't do all of that when I was your age, and I didn't have to do all of that, because sometimes there's not that buy-in, and they don't understand it. But it's important, and we want them to understand why we're doing it. Sometimes we just have to go on, explaining, providing, this is why I'm doing it, this is how it helps me, and acknowledging that, yeah. I know you didn't do that back then. And I know you didn't do it and you raised your kids and you didn't have to have therapy. But I find it helpful. And this is why and how I find it helpful. So I don't have to, try to get them to exactly see it and buy fully in, but just helping them to understand. I know you didn't have to do it and I know you made it through without it, but I have found it as a resource and this is why. I hope that answers the question.
Yeah, I mean, it did, and I was just thinking about all the generational things that we do that are different, right? That aren't necessarily accepted by our elders, and but yes, there's that stigma again around therapy and just kind of explaining, and some people just don't share too. I mean,
Mhm.
that's a great strategy or not, but it is, you have that confidentiality about therapy behind you, and if that person's not in your safe circle supporting it, like you mentioned so well, Dorina, maybe then you just keep it to yourself, keep it between you and your therapist.
Yes, yes. And I think it can also be hard too when we have this family culture or even just our community culture of we don't tell people about our stuff. So why are you doing that? Like just talk, keep it in the house, keep it between us. And so it really can feel like you're kind of breaking the culture line or you're kind of go stepping outside of what is perceived as part of the way that we do things when you step outside. I mean, it can be really challenging if that's the situation. And then it's more like, again, this is how I find this helpful. This is why I'm doing it. And this is what I'm getting from it. And you may not understand that. And I know it, you don't get it. But this has worked for me and this is why.
Yes, thank you for that. Okay, so Jane said that was amazing. Thank you so much for being open about your own experience with anxiety.
Mm,
I have changed therapists a few times. My current therapist is a Brazilian Black woman living in Brazil, as I haven't found Black therapists in Ireland yet.
mhm, mhm. But
Yeah,
I like that you found what you needed. And it is good. Sometimes, we're looking for something specific because you're going to think about it. You're going to be trying to talk about a lot of stuff and you want to feel comfortable and like the person you're working with can hold that and they get it. And they don't always have to, look like you, but you do want to have this sense that they get it, they understand it. And again, when people have profiles out about themselves, it gives you a better understanding of who you're going to likely connect with.
right. And I know this world with, I mean, ideally we're in person, right, with this kind of work. Yeah, yeah. But in this world, we,
Ideally, but
yeah, could do things over Zoom.
yeah.
And some of these programs too as well have their own confidentiality built
Hmm.
in as well, and you can use a password and all these things so that you're not being recorded or any of that stuff. But yeah,
Exactly.
yeah, yeah,
Yeah.
it's
Well,
fine that
this has been
person.
wonderful.
Yeah,
Oh, and I'm again happy to answer questions, but I appreciate everyone, sharing and being attentive. Um,
yes, yes, thank you so much, Dorina. And how can people get in touch with you?
oh, I did have my information up on the screen.
Oh, okay, that's fine if
It
it's
is probably easier for me to do that. Yep. So my email is there, first name dot last name at worksoffaith.net. My Instagram got hijacked, so I'm kind of working through that. It's on there, but I'm not active yet because we're trying to resolve that. And then my phone number is there as well.
perfect. Thank you so much again for spending your Saturday with us. It means
Yes.
everything. RTZ Hope, we are really passionate about the issue of the the Black community and around perinatal health and loss. And the more that we can get this information for people who need it, the better we're going to
Mhm.
all be as a society. So I so appreciate you, and
Yes. Thank you.
I hope that people can find you and can reach out to you or read your book or see this recording. So much good information here, and again, thank you so much.
Right. Yes. Oh, and I forgot to, it's not on there, but the website is actually worksoffaith.net. So you can see other things that I have going on there. But thank you. Thank you all for being here. And again, thank you, Kylie, RTZ Hope. Appreciate all of the support and the opportunity to be here. And Melinda, you were